Hello, everyone. Welcome to another episode of the Nurses Heartbeat. My name is Philip. In this episode, we are going to look at mastering, select, or that apply questions in the NCLEX exams. Now, this is one of the most dreaded topics the NCLEX can give you. Mastering, select, or that apply. We simply call it the SATA questions. Now, this SATA is a critical skill exams. They are testing your critical thinking and not just a record. So you are going to have a lot of questions and they will ask you to select all that applies. So just a quick overview and how you'll be able to go about this one, because this is a high level thinking. All right, so I'm just going to help you to be able to go through select all that apply exams. Now, quickly, you know that the SATA questions test critical thinking, and then it's not just a fact recall. They are usually tied to patient safety. So, topics under SATA that you are going to meet, you'll be looking at patient safety. We are also looking at nursing interventions. So, you normally have SATA questions around nursing interventions. You are going to have about priority assessment. So assessments that will need prioritization, you are going to have these under SATA as well. Now here, you are not just going to pick a right answer, you are going to pick all the correct answers. Now, it is quite tricky because sometimes you will find it difficult to know whether only one answer is correct or all the answers are correct. And that is what you need to do here. So, there are some tips or strategies that you need to know when working on the SATA questions. And the first one is treat each option like true or false. So, maybe you have 5 or 6 options you are going to read, then take each one as individual question and treat it as true or false. All right. So what you have to do is that you have to assess if this is correct for the patient at that time. The question or the option they have provided, is it correct for the patient at that particular time? Most of the time, the SATA, you may have a preamble that are giving you information about the patient. So you need to use that information from the preamble to see if the options are applicable and they are correct for the patient at that particular time. It is very important to note that. And then the second strategy in solving the SATA question is that don't assume there might be multiple correct answers. No, there is no need to, for assumptions. Sometimes there will be only one correct answer, and sometimes all of them may be correct. Sometimes there may be few of them that are correct. So you don't assume whether there may be all correct or only one correct. Just look at individual options and treat them separately. All right, and that is going to help you. And then know your fundamentals, very important. That is the third strategy. Now, the SATA loves infection control. So the fundamentals about isolation, fundamentals about PPEs, patients that are going through isolations, patients, you need to take precautions, measures. They are very important to SATA, and you have to look at that. Now, when we come to infection control, we know methods of isolation. There are so many methods. Know your fundamentals, your infection control measures, your PPEs, your isolation protocols. Just revise that and know them. And then the other thing under SATA is medication side effects. As my previous videos where we talked about some of the critical medications that NCLEX will test you on. Example is antihypertensive medications like the beta blockers that have effect on both the blood pressure and the heart rate. you have to know the side effects of some of these medications. If you are going to give diuretics like furosemide, loop diuretic, you know that it is going to bring the potassium levels down. All right, so you have to look at that. If you are going to give potassium sparing diuretics like the spironolactone, you know that it can also cause high levels of potassium in the blood. So know the side effects of the medications that you are going to give, because SATA will want to test you on these side effects as well. And one critical area that you also need to know is assessment versus implementation. We said that one of the ways that they want to um, test you is to make sure you know your nursing plan protocol, where we have the ADPI. We talk about the assessment, the diagnosis, the planning, the implementation, and the evaluation. They want to make sure that you are a nurse, that you are able to assess before you implement. So most of the time they are going to test you on that to make sure you are doing correct assessment and correct implementation. So these are fundamentals you have to know. If patient is having asthmatic attack, if what are the assessments you need to know. If patient is having probably urine infection, what are some of the assessments you need to know, and then what are the implementations you need to know. These are the basics that you have to get on top of them, and they are very helpful. And then know your ABC, very important. I said that in the previous video as well. Your airway, your breathing, your circulation, your assessment for your ABC, even D and E. All right, from when patient comes in and you need to assess the airway, you need to assess the breathing. All right, so your respiration rate, the depth, the rhythm, and then the breathing, the chest symmetry, where the patient is breathing with accessory muscles, and all of that. You need to make sure you are getting all of those things. And your C, where you go to your circulation, all right, including your capillary refill time, which shouldn't be ideally more than 2 seconds, and your pulse rate and blood pressure, all of that. So you have to make sure that your ABC assessment, you are key in that angle as well. Then the strategy that I also want to talk to you about when dealing with SATA is the use of elimination. You have to use elimination method very carefully. Now, if you are unsure of any answer, you think this answer is not applicable, just eliminate it. All right. So eliminate every wrong answer that you may find in the exams. If you think this is not applicable to the situation, just eliminate it. Now, every choice is a chance to score or lose a point. Okay, so if you think this is not applicable, take it away. You might be right or you might be wrong, but if you are unsure, make sure you are using your elimination method very critically. Now, let's look at some of the topics that SATA tests on. Okay, so you may have SATA in a lot of topics like diabetes care. You may have SATA in that. Then cardiac meds. So the last time we talked about the beta blockers, where you have your bisoprolol and all the low medications, and your ACE inhibitors, the lisinopril and nalopril, that we said the common side effects are ACE, angioedema, cough, and then elevated potassium. So you have to know these cardiac medications, beta blockers, ACEs, and the rest. They will do the all test or the apply, select or the apply in that angle as well. Then the next thing that you have to take note is your psych medications. All right, medications for depression, for anxiety, and for other psychiatric conditions. And then you have to know the safety precautions. Okay, medications for Parkinson's, medications for epilepsy. You have to know these medications, and then the precautions you need to take when giving these medications. They are very, very important. example of a SATA question. Okay, so let's have this one try. So this is the question. The nurse is caring for a patient with heart failure receiving furosemide. Which of the following interventions should the nurse implement? So when you have a question like that, you are going to track some key important things. Okay, so the nurse is caring for a patient with heart failure, so you can underline your heart failure, and then patient is also receiving furosemide. Okay, so patient with heart failure and receiving furosemide. What are some of the expectations? Okay, and what are some of the um, side effects of the furosemide the patient is taking? So when you think around these things, then you go into the options. It is going to help you to eliminate and to know something. So let's say quickly, patient with heart failure. We know that patient with heart failure, you are not going to load this patient with a lot of fluids. Okay, you don't want to put pressure on the heart. Then patient is taking furosemide. You know, furosemide is a loop diuretic, so there is a possibility of losing potassium. Patient is going to pee a lot and all of that. So hypokalemia is a side effect of furosemide. And just a little things you can note about these two key facts in the question. Okay, then you go to the options given you, and you'll be able to answer some of the um, questions that will come. So let's look at the options quickly. So our patient with heart failure receiving furosemide, which of the following intervention should the nurse implement, select, or that apply? So let's look at the questions quickly. So A, monitor potassium levels. True or false? Very important, because we know that taking furosemide can decrease your potassium. So monitor potassium levels is is a key. So it applies. Then the B, encourage increased fluid intake. Do you think this will be correct? Patient is having heart failure. We don't want to give more fluid. We don't want to overload the patient. And the question is, we should encourage more fluid intake. I disagree with that. So I'm not going to take that. So I will eliminate it. Okay. Then the C is assess for tinnitus. So tinnitus is problem with the ear, ototoxicity. In my previous video where we reviewed furosemide, we realized that furosemide can cause tinnitus as ototoxicity side effect of the medication. So that is a tick box is also correct. And then weigh the patient daily. Definitely. When patient is taking furosemide, we want to drain fluid from the body. If it is congestion in the heart or in the lungs, we want to drain that. And one of the most effective way of assessing the effects of the medication is to weigh patient daily. So that is also important. And then the E is hold medication if blood pressure is 150 over 90. Do you hold the medication? We said furosemide can lower the blood pressure as well. Okay, so when you are giving and the blood pressure is very low, you are going to hold it on. But this one, the blood pressure is 150 over 90. It's high, it's not low. So are we going to hold it on? No. All right. So we can see that these are the options they have given you, and we've tried to think through the options they have given and see how they are applicable or not applicable to the questions. Let's look at the answers they provided. So the A, monitor potassium. Yes, because furosemide is potassium wasting. We said that. And then option C, access for tinnitus. Yes, risk of ototoxicity. And then option D, weigh patient daily. Yes, because we are tracking the fluid status and we are making sure patient is bringing out some overload of fluid from the body. Now, option B, which said increased fluid intake, is incorrect, because in heart failure, we want to rather restrict fluid intake. And option E, which said we should hold when the blood pressure is 150 over 90, is is not correct because it's a critical medication and the blood pressure is also not very low as well. Okay, these are how we apply the select or that apply questions. Okay, so you are going to make use of your elimination and you are going to think through, and because we have done a review of some of these medications, the side effects, the nursing considerations, you are able to pick the right from the wrong. And this is how it's going to help you to handle the SATA questions. Very, very important. Now, you have to practice with confidence. You have to get exposed to a lot of these questions. You have to get your content correct. And when you read the question, you need to track some key points in the question. Think about it. Think about how each of them are going to affect the patient. Then you go through your options and you'll be able to eliminate some of the wrong answers straight away. So that is it for the SATA questions. We will have time and go through quite a lot of SATA questions, but these are the basics that you need to be able to practice the SATA questions on your own. All right. So this is the end of the episode. If you have any question, put in the comment section. If you like this video, I want you to subscribe and hit the notification button so that anytime I upload a new one, you are going to get notification on it. Thank you very much for watching the video. I want you to share to your classmates, to your classmates, to your colleagues, and it is going to bless somebody as well. My name is Philip again, and this is the Nurse's Heartbeat, where every heartbeat matters. You are just one step away from passing your NCLEX. Thank you for watching once again. See you in the next episode.